I think probably the most exciting aspect of this latest paper was a technique that we used at the synchrotron to image these. So it's called phase contrast imaging, and it takes advantage of the unique properties of the synchrotron in delivering high energy beams that can do fantastic imaging of samples. In this case, cartilage. The quality of this technique might be able to increase the ability to detect osteoarthritis, which is a joint disease, this cartilage in your joints, earlier than regular kind of clinical monitoring of that tissue can do. By the time a human or a patient knows that they have a problem, it's because that's a pretty late stage in their disease, okay? So the kind of therapies that humans undergo are pretty dramatic. The type of imaging that we're doing, there are companies that are, in Japan, there's a company that is trying to adapt the technology and make a portable imaging system that can do that type of imaging, but have it be brought directly into the clinics. If you can get a hint from that imaging that you're on the path towards severe osteoarthritis, then it opens up a whole wide range of opportunities to develop drugs that can target that condition earlier before it gets really at the late stages.